Welcome. Today, I take this opportunity to introduce you to a very important subject of jaundice in infants and the various things you should look out for and can do. A common condition in newborns, jaundice refers to the yellow color of the skin and whites of the eyes caused by excess bilirubin in the blood. Bilirubin is produced by the normal breakdown of red blood cells. Normally, bilirubin passes through the liver and is excreted as bile through the intestines. Jaundice occurs when bilirubin builds up faster than a newborn's liver can break it down and pass it from the body. This is because newborns make more bilirubin than adults, since at birth their hemoglobin concentrations are higher than at any other time in life. This leads to too large an amount of bilirubin being reabsorbed from the intestines before the baby gets rid of it in the stool. High levels of bilirubin, usually above 25 milligrams, can cause deafness, cerebral palsy, or other forms of brain damage in some babies. In less common cases, jaundice may indicate the presence of another condition, such as an infection or a thyroid problem. The American Academy of Pediatrics AAP recommends that all infants should be examined for jaundice within a few days of birth. The most common types of jaundice are physiological or normal jaundice, jaundice of prematurity, and breastfeeding jaundice. Physiological or normal jaundice occurs in most newborns at 2 to 4 days of age and disappears by 1 to 2 weeks of age. Jaundice of prematurity occurs frequently in premature babies since they are even less ready to excrete bilirubin effectively. To avoid complications, this needs to be treated at a lower bilirubin level than in full-term babies. Breastfeeding jaundice occurs when a breastfeeding baby is not yet getting enough breast milk because of difficulty with breastfeeding or because the mother's milk isn't in yet. This is not caused by a problem with the breast milk itself, but by the baby not getting enough to drink. The goal of jaundice treatment for newborns is to quickly and safely reduce the level of bilirubin. If the infant's bilirubin is rising and the mother is able to produce sufficient milk, increasing the frequency of breastfeeding at least 8 to 12 times a day for the first few days is recommended. However, if the infant's bilirubin is rising and the mother is unable to produce sufficient milk, giving the infant formula after each breastfeeding and using a manual or mechanical method for increasing milk expression is recommended. Phototherapy is the most common and relatively non-invasive treatment for jaundice. Light causes a chemical reaction in the bilirubin, changing it to a form which can be excreted directly without needing to be conjugated in the liver. The most commonly used phototherapy units contain daylight, cool white, blue, or special blue fluorescent tubes. A light of maximal efficiency is necessary when treating infants with very high bilirubin levels. Phototherapy should always be carried out in the presence of a medical practitioner. Another important factor to consider during phototherapy is the distance of the infant from the light source, especially since halogen spot lamps are likely to cause burning if placed too close to the infant. Therefore, while using halogen lamps, it is very critical to follow the manufacturer's recommendations, and special care should be taken to ensure that the infant is not placed any closer to the light than is recommended by the manufacturer. In case of fluorescent lamps, the fluorescent light source should be as close to the infant as possible for maximal effect. It is therefore necessary to place the infant in the bassinet and not in an incubator. To summarize, the following things need to be kept in mind when faced with jaundice in newborns. First, ensure frequent breastfeeding, and if required, support breastfeeding with infant formula. If necessary, turn to phototherapy or exposure to sun.